Gastrointestinal system questions. In a patient with diagnosis of chronic pancreatitis, what may be the possible serum amylase value? Option A 44 units per liter. Option B 105 units per liter. Option C 300 units per liter. Option D 600 units per liter. The correct answer is option C 300 units per liter. Normal serum amylase level is 25 to 150 units per liter, and in chronic pancreatitis, the rise in serum amylase levels usually within 3 times the normal value. In acute pancreatitis, the value can exceed 5 times the normal value. Options A and B are within normal limits. Option D is an extremely elevated level seen in acute pancreatitis. Second question. In patients with cirrhosis of liver, thiamine helps to reduce ill effects. Which of the following food item is rich in thiamine? Option A pork. Option B milk. Option C chicken. Option D broccoli. Correct answer is option A pork. Pork products are especially rich in thiamine. Other good food sources include nuts, whole grain, cereals, and legumes. Milk contains vitamin A, D, and B2. Poultry contains niacin. Broccoli contains vitamin C, E, K, and folic acid. Third question. To ensure correct placement of nasogastric tube, the nurse aspirates the stomach contents and check the pH. Correct tube placement is ensured if the pH value is option A 3.5, option B 7, option C 7.25, option D 7.55. The correct answer is option A 3.5. If the nasogastric tube is in stomach, the pH of the contents will be acidic and it should be 3.5 or lower. Fourth question. When removing a nasogastric tube from a patient, nurse should instruct the patient to do which of the following? Option A exhale. Option B inhale and exhale quickly. Option C take and hold a deep breath. Option D perform a Valsalva maneuver. The correct answer is option C take and hold a deep breath. When removing a nasogastric tube, the client is instructed to take and hold a deep breath. This will close the epiglottis and allows for easy withdrawal through the esophagus into the nose. The nurse removes the tube with one smooth and continuous pull. Fifth question. In a patient with esophageal varices, a Sengstaken-Blakemore tube is inserted. Which of the following items must be kept at the bedside at all times? Option A an obturator. Option B Kelly clamp. Option C an irrigation set. Option D a pair of scissors. The correct answer is option D a pair of scissors. When the client has a Sengstaken-Blakemore tube, a pair of scissors must be kept at the client's bedside at all times. If any respiratory distress occurs in the patient, it may be because of the gastric balloon ruptures and the entire tube moves upward. In such cases, all balloon lumens should be cut and the tube should be removed immediately. So, a scissor should be kept at bedside at all times. An obturator and a Kelly clamp are kept at the bedside of a client with tracheostomy. An irrigation set is not the priority. Sixth question. While reviewing the physician's order written for a patient with acute pancreatitis, the nurse is likely to question which of the following orders. Option A, NBO status. Option B, nasogastric tube to be inserted. Option C, morphine sulfate as painkiller. Option D, an anticholinergic medication. The correct answer is option C, morphine sulfate as painkiller. Morphine sulfate can cause spasm in the sphincter of OD and so not used as painkiller in pancreatitis. Meperidine is usually used in pain relief. Seventh question. When performing an abdominal assessment, after inspection, the nurse performs which assessment techniques next? Option A, palpate the abdomen. Option B, palpate the liver at the right rib margin. Option C, listen to bowel sounds in all four quadrants. Option D, percusses the abdomen. The correct answer is option C, that is, listens to bowel sounds in all quadrants. The appropriate sequence for bowel examination is inspection, auscultation, percussion, and palpation. Auscultation is performed after inspection to make sure that the motility of the bowel and bowel sounds are not altered by percussion or palpation. Eighth question. Chronic gastritis can cause risk for which vitamin deficiency? Option A, vitamin A. Option B, vitamin B12. Option C, vitamin C. Option D, vitamin E. The correct answer is option B, vitamin B12. Chronic gastritis causes deterioration and atrophy of the lining of the stomach. It can lead to the loss of function of the parietal cells and in turn intrinsic factor production. It results in the inability to absorb vitamin B12 and may lead to the development of pernicious anemia. Intrinsic factor is needed for the absorption of vitamin B12. Ninth question. In a patient with peptic ulcer, which finding would most likely indicate perforation of the ulcer? Option A, bradycardia. Option B, numbness in the legs. Option C, nausea and vomiting. Option D, a rigid broad-like abdomen. The correct answer is a rigid broad-like abdomen. Perforation is characterized by sudden, sharp, severe pain beginning in the mid-epigastric area and spreading over the abdomen. Abdomen becomes rigid and broad-like. Nausea and vomiting may occur. Tachycardia may occur as hypovolemic shock develops, not bradycardia. Numbness in the legs is not an associated finding. 10th question. A patient with peptic ulcer is scheduled for a vagotomy. Vagotomy is done for which outcome? Option A, halts stress reactions. Option B, heals the gastric mucosa. Option C, reduces the stimulus to acid secretions. Option D, decreases food absorption in the stomach. The correct answer is option C, reduces the stimulus to acid secretions. In vagotomy, cutting of the vagus nerve is done to eliminate parasympathetic stimulation of gastric secretion. Thank you very much for watching. Happy learning.